Welcome back to Curious Conversation. Our eminent guest today is Dr. So. How are you doing, Dr. So?
Good, thank you.
So, Dr. So, today we're going to discuss a new article that you published in Cureus, Gender Biases Toward People with Difficulty in Balancing Work and Family Due to ADHD, two vignette cases featuring Japanese laypersons and psychiatrists. But before we get into that case study, can you tell me a little bit about yourself and your background?
Yeah, please.
Go ahead. Yeah, tell me about yourself.
Okay, my background. Yeah, well, I have currently three positions. I am a psychiatrist with around 10 years of experience, and I also have been involved in clinical research since 7 years ago when I entered the School of Public Health in Kyoto University. And on the top of them, I am an employee of a startup company which develops and sells smartphone apps for people with medical disorders like nicotine dependence or hypertension. And there, I lead a project to develop and implement a smartphone app for people with alcohol dependence. That's my background.
Wonderful. Well, thank you for sharing, Dr. So. So let's go ahead and get into your paper. What initially drew you to this subject, and what sparked your interest in the implications of gender biases towards those with ADHD?
Yeah, thank you for asking. Let me explain our experience as a clinician behind the study. Well, as a clinician, we often see that women with ADHD appear to blame themselves more than men with ADHD when they struggle to balance work and house chores, such as cleaning their room or parenting because of their ADHD. So we hypothesize that these feelings of self-guilt might be related to cultural factors such as differences in gender roles and criticism from others based on social norms related to gender roles. So in countries with a large gender gap, where Japan is one of these countries, there is a strong belief that women should take the lead in housework and childcare. Patients with ADHD who have traveled in these areas are more likely to be dealt with implicit, implicit gender bias by others in their daily life than the general population. So these are the reasons why we chose this subject.
Awesome. And why is it important to examine the potential gender biases towards those balancing work and family because of ADHD?
Well, as I said earlier, implicit gender bias built into societies may lead to a burden on patients with ADHD. So if the people around them or the mental health professionals deal with them with a gender biased attitude, it may have a big impact on them. In other words, if friends, parents, siblings, or attending psychiatrists around women with ADHD give such advice as you should reduce your work and concentrate more on housework and childcare, it may affect the course of the patient's symptoms and their life. So we thought it was a very important subject.
Awesome. And could you go ahead and walk us through your paper?
Sure. Our paper combines the results of two case-Binet randomized studies with two populations that were Japanese general people and Japanese psychiatrists. To conduct the study with Japanese psychiatrists, the Japanese Society of Psychiatry and Neuroscience greatly helped us. Besides the population, the designs of the two studies were almost the same. Participants were randomly assigned to read either a male or female case vignette that described an individual with ADHD struggling to balance work and family. The description of the two case vignettes was identical except for gender-related descriptions like she or her, wife or husband, mother or father, etc. After reading the case vignette, participants answered 2 questions about their opinions on the seriousness of the case and the degree to which the case wish should be maintained. They answered using sliding scales from 0 to 100. And our hypothesis was that the scores for the 2 questions from 0 to 100 would be greater in the male case vignette group than in the female case vignette group. However, our results reveal no significant outcome differences between the groups assigned to the male and female case vignettes. And that's the short summary of our article.
Great. And what do you see as the implications or impacts of this study?
Thank you for asking this. Well, our results suggest that there might not be a strong gender bias in the perception process of Japanese general people and psychiatrists when meeting individuals with ADHD who struggle to balance work and family in the hypothesized situation. This finding is encouraging, as it may indicate a shift in societal attitudes toward gender roles and the recognition of ADHD with difficulty in family-work balance. However, the generalizability of our results is limited to the specific population and the specific hypothetical situations presented in written text form. I thought it's the biggest limitation of our results.
Great. And what work do you and your team have planned for the future?
Well, our future work, indeed, I aims to expand the scope of our research to include other cultural contexts and populations to gain a more comprehensive understanding of gender biases and ADHD. In addition, I'd like to incorporate other modalities to present hypothetical cases, such as movies or chatbots using large language models like GPT-4, which can provide a more dynamic and interactive approach to studying biases. Well, these modalities may help us observe how people's perceptions and biases may change when faced with different types of stimuli and interactions. For example, movies could help us study biases in more realistic scenarios, while chatbots could simulate real-life conversations, providing a platform for observing how people respond to and interact with individuals with ADHD in various contexts. Yeah, that's our future plan.
Awesome. So now just to excuse me, sorry. So now just to pivot to a little bit more of a personal question, what has been the most rewarding part of your career so far? You do a lot of work with ADHD, right?
Well, yeah, I have some work related to ADHD, but my main theme is addiction. Yeah, so I have some articles about alcohol dependence and gambling disorder and internet addiction or gaming disorder. Yeah, and ADHD or ASD are known to be related to such addictive disorders. So I have some article about ADHD. Yeah, anyway, honestly speaking, I have not felt rewarding in my career so far. But yeah, it's worthwhile and rewarding for me to tackle with relevant issues for people with such disorders.
Right. Well, it's always a pleasure to read your work, Dr. So. Well, thank you so much for joining us on Curious Conversations today.
Thank you so much for inviting me here. Thank you.
Yeah.